Hello, everyone, and thank you for joining us. It is my pleasure to welcome you to Session 2 of the 2020 International Nurse Researcher Hall of Fame. The International Nurse Researcher Hall of Fame honors Sigma Theta Tau international members who have achieved significant and sustained national and/or international recognition for their work and whose research has impacted the profession and the people it serves. This year, we are recognizing 19 distinguished nurse researchers, and Sigma President Rick Ricciardi will be speaking with 4 of them during this Hall of Fame session. The presentation of the International Nurse Researcher Hall of Fame is sponsored by Wiley. Wiley works with Sigma staff and editors to publish Sigma's peer-reviewed Journal of Nursing Scholarship and Worldviews on Evidence-Based Nursing, both of which are among the top nursing journals globally and are free to Sigma members as a membership benefit. On behalf of the Sigma Board of Directors, we thank Wiley for their continued support. Now, we have a brief greeting from Wiley. The 4 Hall of Fame honorees in this session are Dr. Jason Farley, professor and nurse practitioner at Johns Hopkins University School of Nursing in Baltimore, Maryland, USA. Dr. Venora Hundley, Deputy Dean for Research and Professional Practice and Professor of Midwifery, Faculty of Health and Social Sciences at Bournemouth University, England, United Kingdom. Dr. Susan Latter, professor at the University of Southampton School of Health Sciences, also in England, United Kingdom, and Dr. Karen Monson, professor of nursing at the University of Minnesota School of Nursing in Stillwater, Minnesota, USA. Full biographies for all our honorees are available in the Honorees and Award Recipients booklet in the Resources area of the conference website. I encourage you to read about the outstanding work of these researchers. Now, it is my pleasure to introduce Sigma President Rick Ricciardi as he talks with our honorees. Enjoy the conversation.
Well, hello, everyone, and welcome. I'm excited to present today 4 incredibly talented and accomplished researchers to share some of their wisdom, some of their insights to all of us to help us to be better prepared and better implementers of research. So I'm going to keep the introduction short here, but so that we can get right at it. So I'm going to provide a series of questions, and they're going to provide some short answers, and then we'll have a little bit of a dialogue. So I'd like to start this morning with Professor Farley. And Professor Farley, what strategies have you used to bridge the gap between your research and clinical practice?
Well, thanks, Rich. Fantastic question. I am an actively practicing nurse practitioner, and many, if not all, of my ideas come directly from clinical practice, and I put that directly into my studies. So for my HIV clinic, in which I'm a nurse practitioner, my patients teach me every day. They teach me exactly what I need to understand and the struggles that they're having for viral suppression. I then design what I call systems level interventions that have components of technology, components of healthcare workers, such as community health workers or nurse led models. And then I look at ways in which we can improve the system of care to make it, a slipperier slope, to let people slide into good health outcomes, if you will. And so in terms of what we're doing with that, I root my interventions in my clinical practice so that when I'm recruiting my patients, they are coming directly and benefiting directly from the types of studies in my clinic in which all of our patients are just really doing a fantastic job of viral suppression. But we have that population, about 10 to 15% of our patients who struggle. And it's often mental health and substance abuse and addiction issues that are causing them to lack viral suppression. And so it really gives that extra edge for those patients.
Thank you very much. I appreciate that, Professor Farley. And moving to a completely different program of research, but not any less interesting, I must say, I'd like to ask Professor Monson the same question on strategies that you have used to bridge the gap between your research and clinical practice.
Thank you, Richard. And building on what Dr. Farley has just shared, we at the University of Minnesota are leaders in big data research, which is kind of the other end of the spectrum here. And I've been really fortunate to maintain close connections with clinical practice community partners locally, nationally, and globally, because I come from public health nursing. And we are a close-knit, like-minded research community that thinks about population health and the greater good first. And I think that our focus on improving health for populations is similar to what Jason was talking about, in that we build on what we have known from practice together. We're thinking about sharing our data, and that is so unusual in the research community. I think we have that population health, that shared public health impetus to move populations towards better outcomes. So I'd say the main strategy that I've used is maintaining good relationships and networking with potential collaborators to extend the public health network and create win-win opportunities that serve both practice and knowledge discovery.
Thank you. I see this as the window to the future. These two, not opposing forces, but two dynamic forces that are very much interconnected in providing us with what we hope to be much more capability, not only in conducting novel research, but also to implement and really understand to a much quicker degree the impact of that research in marrying up those two extremes. So I think that's where the future lies for a lot of what we do. It's not what we're doing now that isn't excellent, but we need to think about that. So moving across the ocean thinking about your early career and your early experiences as a researcher, I'd like to move to Professor Hundley and ask her, what do you consider to be the most important characteristics of a researcher?
Thank you. I think it is it's resilience and maybe a wee bit of persistence. And I think the way that researchers achieve that is by remembering what really matters when they're doing the research. So thinking that this is about the client or patient experience, that's why we do research. It's for a better outcome. And if you can keep that at the forefront, that gives you a bit of resilience when we get some of the knockbacks. I think what we've done at Bournemouth University is really build a cohort of early career researchers. So they're working together, supporting each other. And that helps them to remember that everybody, including professors, get knocked back in terms of publications and grants. It's part of being a researcher, and helps them to put back in focus the reason why they're doing it. So I think that's key. having a support network. And again, Sigma provides a lot of support and connections for people working together. That support network is really vital to help them have that resilience.
Thank you. I appreciate the plug too. If I do it, it's called a selfless plug, or a shameless plug. But if someone else does it, it's considered appropriate. So thank you. I agree with you about Sigma, by the way. So thank you for your response, and I think there's a lot there for young and all researchers to think about. Now, I think this is a great question for Professor Latter, because when you look at her research, she has. You all have very much interprofessional colleagues that you're doing your research with her. But what's very striking to her research is that she really has reached out across the aisle, if you will, to be very inclusive in thinking about her times of research. So, Professor Latter, what characteristics or criteria do you consider in determining who, the composition that you include in your research team?
I'm so pleased you asked me that question. Yeah. You've noted, and it's very true, that my research is characterised by interdisciplinarity. So for many years, I've worked with pharmacists, psychologists, medics, sociologists to inform my research questions. So I think it's critical, really, that we all bring to the table different skills from different disciplines. And so I'm always looking for opportunities to work with people from different disciplines. I think that's the name of the game, and I think you can't really do good research without reaching out across the aisle, as you say, to colleagues from other disciplines. At Southampton, I think that's relatively easy to do. We have very low boundaries, and I think the opportunity is there to do that, the way that the faculty is structured. So I work very closely with colleagues in psychology and in medicine, and it's about reaching out. And I think, just to go back to that last question, I think as a young early career researcher, it is about reaching out and being bold and reaching out and showing people what nursing offers and what nursing brings to the table. But I think it's about nursing being a part of the team. I think too that in the research team, it's really important that we have people at different stages of their research career, so that they get opportunities to learn from more senior colleagues perhaps, so that there are opportunities for mentoring, as well as that interdisciplinarity. That again has worked well for me, I think, bringing younger colleagues on so that they feel part of teams, that they have work packages to lead, so they're starting to develop independence. All of those are incredibly important, and I think can be part of a good team.
Wonderful, thank you. And I was very much impressed on how broad-scoped your teams are, and how you, as a leader, can you speak maybe a little bit on the leadership of that? What types of attributes or skills or characteristics you feel like you've had that made you successful in that? Maybe what dynamic of your persona or your leadership skills that helped you to be successful?
Mm-hmm. It builds over time, I think. It takes courage, I think, to actually reach out and show someone that you've got something to offer. But I think we all are ambassadors for nursing, and that we have something unique to offer. I think sometimes we shy away from that, and we shouldn't. Mm-hmm. And I think it's once you've made that step and people learn what you have to offer and what uniquely nursing brings to the table, that they then start to understand. So it's about, it's harder at first, but it gets easier. So it was hard for me at first, but it's got easier as I've started to develop relationships with colleagues. So it's about being brave and being bold, I think. Mm-hmm. But it's about believing in yourself and taking that hard step, because it does get easier. I think it's about understanding different worldviews and working with different worldviews. And again, I've worked with lots of colleagues in clinical practice who I think have not a different worldview, but they have different agendas to work to. So I think it's being understanding of that and knowing what matters in different disciplines and different worldviews, and trying to build bridges and work with common goals. So I think it's understanding that. And I think it is reflecting on and being aware of what you bring to the table and what your uniqueness is.
Mm-hmm. Thank you. I appreciate that. That's great ideas. So back to Professor Farley, and I know your research is international. You've done work in Africa and other places. And of course, you're at Johns Hopkins, which has a pretty broad international footprint. Given that STTI is an international organization, what do you think STTI or Sigma can do to facilitate collaboration among nurse researchers around the globe?
I think it's an excellent question. I think first and foremost, we as a nursing community and facilitated by Sigma need to be more transparent about where we're operating and where we're working. I often, literally with my own university, will be working throughout sub-Saharan Africa, and someone will say, "Oh, are you with the Johns Hopkins team for doing X?" And I'm like, no, I don't even know who that is. So even within our own universities, I would say that that's a challenge, much less thinking about nursing as it relates in a much broader audience. So I would say, having a repository of, nurse scientists who are engaged in a given area, on a given topic, and in a given specialty area would be an excellent way of facilitating at least communication between investigators who might be in a shared space or in a shared locale.
Wonderful. Thank you very much for that. We have a few minutes left, and I'm going to ask us to do two things now. I'm going to ask on what advice would you, I'm going to ask a little bit on the funniest thing that you have occurred or interesting experience that you had as a researcher. And if we have time, maybe we'll ask any. And Professor Hundley, you look like you have lots of funny experiences. And given the population that you serve, because my sister is a midwife, and I know what kind of experiences midwives have, so I'm curious to ask you that question. On a lighter note, please tell us about the funniest and most interesting experience you've had as a researcher.
Well, I suppose it's an interesting experience. As an early career researcher, we were conducting a study looking at cystic fibrosis screening, and we were interested to know at that time whether women would prefer single screening, so just themselves to know whether they carry the gene, or whether they would like their partner to be screened as well. With many of these community surveys, we have to go out using different methods, and we used the electoral roll to ask people to volunteer to be part of the study. So women would write in that if they were of reproductive age and say, yes, they'd like to be part of the study. And so I went to a lot of houses, talked to a lot of women about cystic fibrosis, and they predominantly had a reason for wanting to come forward. And this one afternoon, I turned up at the house and I knocked on the door, and this lady who must have been in her 80s opened the door. And I said, are you Mrs. A? And she said, yes. And I said, but you said you're of reproductive age. And she said, yes. I knew I didn't fit the criteria, but I really wanted to talk to somebody. And so I had a lovely afternoon of tea and cakes, and we talked about cystic fibrosis, and we talked about many things in her life. And I suppose as a young researcher, I think that tells you just have to be a wee bit flexible. You have to go with the flow, and sometimes some things are more important than the research.
Mm-hmm. Yeah, I've written a lot, and I've spent my whole career around the concept of serendipity. I really do believe that as a researcher, curiosity is the biggest driver. And my perspective is no matter what you're doing, regardless of what you're doing, there's something to be learned from it. There's something to be curious about. And for example, that event with you probably led to you to be thinking about so many other things, and you just don't know. But I think if we go into all these experiences with a sense of serendipity and curiosity, we'll always come out perhaps a little bit smarter, maybe a little bit more tolerant, a little bit more understanding. So we have maybe a couple of minutes left, and I'm going to go around, and if you could keep it down to like less than 15 seconds and just shoot out words. We're playing a word game here. In terms of a few words, what advice would you give to a novice researcher right now? If a brand new researcher came into your office and said, in 3 or 4 words, tell me how I can be successful. What advice do you have for me? Let's start with Professor Monson.
Oh, big data research, definitely. Starting with a question that has clinical significance and just explore and let the data speak.
Thank you. Professor Latter?
I would say two things which aren't necessarily, they are complementary, I think. Be thoughtful, be curious, ask questions. Don't take for granted, but keep asking questions, have curiosity. And secondly, I think, as I said earlier, be bold. You need to network, you need to show people, you need to be head and shoulders above others, so you need to reach out, and that takes courage. So be thoughtful and be courageous.
Thank you. Professor Farley?
I would say clarity of thought and clarity of intent and focus, I think is most important. And the second is don't take no for an answer. You'll get lots of them, and ignore them and keep going.
All right, I love that one. And finally, Professor Hundley.
But they're all great answers, but I would say really know what motivates you, because to be a really good researcher, you've got to have passion. And if you're not passionate about your subject, you'll get bored. If you're passionate, you'll find a way around all of the challenges.
Wow, great stuff. And I personally, and on behalf of all the Sigma members, would like to really thank you all for taking your time, providing us with these wonderful thoughts of wisdom, pearls of wisdom, and importantly, congratulating you all on being selected for the International Nurse Researcher Hall of Fame, which is the epitome of Sigma's accomplishments. So congratulations to you all, and thank you, and please be safe.
Thank you.
Thank you.
Thank you.
Bye.
Thank you very much.
Thank you so much.